Hey, good morning. This is Steve Stein, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. I am so much better at saying that than I used to be when I would stumble all the way through it, Hawk.
Learning.
Did you shave this morning?
Maybe just a little bit. Maybe just a little bit.
You were here early, though.
I was here early. Yeah.
What's going on out there? How are the numbers today?
Numbers aren't as good.
Yeah.
We were happy because they went down. We had 34, 35. The numbers came down to about 24 yesterday, 22. Today they're back up to 30 patients in the hospital with active COVID. 7 of those in the ICU and 6 of those are on the ventilator. Unfortunately, we still have another 28 patients that are in the hospital for no other reason than they are still here for COVID. So that's almost 60 patients.
Yeah, it's 60. That's a lot of patients in beds.
And even Hays is seeing a lot more as well. So Hays has 18 active infections with COVID-19 as well in their hospital.
So, you know, we had our chief medical officer call yesterday, and we had like what we call the big five, and then not necessarily the big five, but they're the hospitals that have been with us, and the chief medical officer have been on really every call with us. And so we know that the total count yesterday for COVID patients in those hospitals was actually, I think, the highest we've had.
Yeah.
And that's KU and Liberty and the St. Luke's Health System, North Kansas City, Shawnee Mission. And when you look at those, we got that count, and it's high, right?
Yeah.
It's really high right now.
And I think, that was telling, again, because you mentioned Liberty, we've had Dr. Adiga on with us. They've typically had, fairly low amounts of people. They have high amounts now, again, like you said, all over the city. And then even when, I had discussions with a friend who's in Springfield, and said it's kind of bad down there, 100 patients and 1 to 2 deaths a day, so it's difficult down there as well.
And I think we spoke about this last night. When you follow the rules of infection control, you really can stay safe. And we're going to talk a little bit more about that and the KU reopening and how well that's gone. Mm-hmm. Hey, with us today are Mara Lovell. How did I do with that?
Good.
All right, good. And Lynn Flora. Both are COVID-19 survivors, but with 2 very different stories. Before we get those, let's see if there are any reporters out there with questions. All right, not hearing those. So, Mara, tell us a little bit about you and what happened with you in COVID-19.
Yeah, so it was about a month ago. September 14th was my first day of symptoms. Hadn't shown any symptoms beforehand. And I woke up that morning with what I thought was just like a little bit of a sinus infection. Checked my temp. It was 99, which was a little high. And then I started getting a migraine, and I was like, well, this doesn't seem normal. Had a cough, and checked my temp again that afternoon. It was 101. And so then I thought, okay, probably should go get tested.
Fever.
Sure enough, came back positive. And then for the first week, it was pretty heavy symptoms. Couldn't breathe, getting up out of bed. Took my wind away, like I was out of breath. Slept a lot, heavy fatigue. And then probably on day 7 was when I finally started feeling like, okay, I'm getting better. I'm kind of out of the woods, hopefully. And then for the rest of those 10 days that I was in quarantine, I was able to kind of start functioning, kind of getting up and walking around a little, getting up, lost my taste and sense of smell. That was all gone. Still working on getting that back. Taste is back, smell is not.
Wow.
But yeah, I mean, it was kind of a scary first 7 days.
It would be scary. A bit about having to be in bed and being so short you really couldn't get up and do things. So now you're a nursing student here at Mid-American Nazarene, right?
Yep.
And you also work as a progressive care patient care assistant on the neuroscience ENT progressive care unit.
Yep.
Tell us a little bit. How did work go? How did school go? How did this affect your life?
So work didn't do during those weeks. School was online, so I was doing a lot of Zoom calls, which was difficult, trying to get the professors to figure out how to use Zoom and try to do as many of the group projects as possible over those 2 weeks. Even just kind of waking up to get on the Zoom call was difficult at times, but we made it work. We got through it.
Now, where do you think your exposure came from?
So I think that Thursday before I started showing symptoms, it was the Chiefs kickoff game.
Oh, you went, didn't you?
I went to a little get-together with a small group of friends. And I didn't have symptoms Sunday night, went to bed totally fine, woke up that next morning, had symptoms, told the people I was with, and a couple more tested positive. So,
Okay.
yeah, they were asymptomatic though. So
Well, that's good, but still, that's a problem. Those big public gatherings, right? I'm gonna bet you guys didn't have masks on.
no, it was at a friend's house. So I mean, it was
Okay.
all very
Right. Inside.
safe. Yeah, inside, outside.
Yeah, those are the struggles.
Yeah.
Those things where you think it's going to be safe and it's not quite. Lynn, you were in the hospital. Your story is a little different. You were in the hospital for 64 days. 45 of those were on a ventilator, and 14 in a rehab facility. How are you doing today?
You know, I'm doing a lot better than I was. I gain on it every day. It's just kind of baby steps, but we knew that's the way it was going to be, and I just thank God that I'm still here to do that.
It's a little bit about your journey. How long ago did you first start getting sick? What were your symptoms, and what led you to the hospital?
Well, I think I'm a little bit different than most people. I came home from work on a Friday after working and just had severe muscle cramps. My daughter had thought that she had contracted it also, so she had gone for a test that morning on a Friday morning. And by Saturday, I said, you know, I think I better go be tested too. So came down there to KU through the drive-through testing area. Sure enough, got the results back on Monday morning, and I tested positive. I had, excuse me, I had a little different symptoms than what you're seeing in a lot of people. I never did run a fever. I never did lose my sense of taste and smell. If anything, my sense of taste and smell were a little bit hyper. Everything was exaggerated. I had nausea and the severe body cramps, and I have an underlying comorbidity of asthma. So by the 21st of July, which was just like the next day, I knew that my breathing was deteriorating enough that I needed to get myself somewhere. So we presented at the emergency department at 3:30 in the morning and went from there.
And so, what happened after that?
I was admitted. I went to Unit 15. Every day, it seemed like my breathing deteriorated a little bit more. I went through the remdesivir. I also did the 2 units of platelets. And it's kind of strange because a couple days after that, I felt so much better.
Yeah.
And then, you know, by day 3, I was right back, if not worse. After about 14 days on Unit 15, they rapid responsed me. Took me back to Unit 61. I spent a significant amount of time there, and from what I understand, that's where I was intubated on my birthday. Not a very nice birthday present, but...
Happy birthday to you.
Yeah, exactly. But, you know, you can look at it 2 ways. It saved my life.
You bet.
So...
Yeah.
And then you were on the ventilator for a long time. Do you remember much of that?
I do not. I do not remember anything after I was rapid response and taken back to 61 until they began to wake me up in early September.
Wow. It's a long time to not know, and probably fortunate because it's so hard as an ICU physician, a former ICU physician here. You know, I think it's best patients don't remember a whole lot about that.
No. And it's funny as you're waking up, you can't sort out real from unreal. So you get little pieces of real, and I know I've spent a lot of time afterward saying to my family, did this happen or that happen? And they'll say, yeah, but it's all intermixed with almost nightmares.
Yeah, and that's pretty typical too.
Yeah.
So then you went to the rehab facility, and obviously you got strong enough to go home, which is great. Still gaining ground, I hope.
I am. When I went over to the rehab facility, I couldn't even stand up. By the time I left, I was walking without a walker by myself, and can't praise the staff everywhere at KU. I couldn't have had better care.
That's great. So where are you now in your journey, and how are you feeling, and what can you do? And I don't know if you work or you stay at home. What's your life like now?
Well, I used to work. I'm a nurse on the GI endoscopy unit there. Now I'm working more on my endurance and a little bit of that. I'm able to get up and walk around the house. I only wear 2 liters of oxygen when I get up now, which I started a little bit higher than that when I went to rehab. I don't require any oxygen at rest, and usually don't require any at night. So it's just going to be a little bit more on my part to be sure that I continue my rehab and build up that strength and endurance that I lost.
Well, I think it's an amazing journey that you've come as far as you will, and I bet you're going to get off oxygen, and but that journey, it takes a while after critical illness in the ICU, sometimes 6 months to really, and even longer to really regain all your strength and to get back to where you were. But it sounds like you've already made great progress. Where do you think your source of infection came from?
I wish I could put my finger on it. Once you contract COVID, you kind of replay through your mind, where in the world did I get this? And I don't really have a good answer for that.
Okay.
I wasn't one that went anywhere other than pretty much back and forth to work. So I don't know.
Okay. Well, good luck on your recovery and on your journey. Jill, these are amazing. These are amazing stories. And Hawkeye, fortunately, we do know that most people who come in the hospital do get better and get out of here. But it's not anything to trifle with too much. We spoke a few early in the program, and we had one of our meetings of our hospital authority board last night, and it was interesting because we reflected on our work with Lawrence and what's gone on there. And you see things like Springfield or St. Joe or Joplin or other communities where they're pretty overwhelmed. And then you look at Lawrence, you say, okay, we brought in 25,000 kids onto a campus with a community, and we really did, that's like a mass migration. We did a lot of testing, and the reality is LMH yesterday had 5 patients with COVID. And then you look at what's going on in Springfield and St. Joe, and you see what happens when a school and a community and a county and a public health department work together, enforce masking, the businesses work with everybody, and there's not all this stuff about, well, the virus doesn't exist, or we don't really have it. No, they worked together, and they kept each other healthy. I mean, I think that's a remarkable story for how to open a college back up in a university, do a great job at that, do a great job within the county and the city. And that folk, they're doing it right. Yeah,
it is difficult because, again, look at the demographic of the people that are mass migrating. It's the younger people. We know that the younger people make up a large proportion now of the new cases, not only in our community, but around the nation as well. So that's very difficult. And it is hard because as a younger person, you do want to be out with friends and have fun and get together. It's just a very difficult time to do that right now.
Yeah. But you can do it if you wear a mask, you keep distance, you follow the rules of infection control, and it's not perfect. But gosh, you look at that, and then you look at other communities where we're getting overwhelmed here in Missouri and Kansas, and you say, you can do it well.
Yeah.
Right? You can do it well.
Yeah, absolutely. And one of the things in her story, I think we have to be thankful. She said she couldn't remember a lot of what was going on. Part of that is due to the critical illness, but I think part of that is also due to the medications, the critical medications that she was able to get because we don't have an overwhelming of our healthcare system and our supply chain, that she was able to stay comfortable on the vet and stay in that state where she doesn't have to remember that or feel.
And you
pain.
can offer better care to people because we know that when you're overwhelmed, you're not going to offer the same level of care, and then mortality goes up. Mara, do you remember much?
I do. Remember it all. I just remember a lot, like the first week of just a lot of uncomfortable pain, standing up from bed and just being like completely winded just to get up to go to the bathroom. Moving from my bed to the chair to Zoom into class and just being like, okay, I'm here, let me catch my breath. Okay, now let's pay attention to school. And like just laying in bed and just hurting and just not being able to get comfortable and not being able to take any medication that would like help the muscle aches or any fever, migraines that wouldn't go away. But
But both of these stories are really similar to what we've seen, what I've seen on the floors myself, who people just come in because they hurt so bad and because they have high fever. They don't necessarily need oxygen, but they stay here for 3 or 4 days because of those symptoms alone. And then the other side of that is we know that people can get better, but then just as she was saying, later on in the course, after a couple weeks here, that's when she started to have the respiratory problems. That's when you see the immune dysregulation and the respiratory failure and things of that, because of all of the complications that have happened after the virus now has been, really essentially taken care of by your immune system. Now it's your immune system going out of control and your cytokine storm that people have heard about as well. So.
Jill, let's see what questions we have.
We have lots of questions. Tiffany wants to know, with Mara, did anybody else in your family get sick from you?
No. So I exposed my family and then a friend, and nobody got it. I live at home with my family, and they quarantined me to the basement. I wasn't around anybody. I would sit out in the backyard at night once I started to feel better and have dinner with my family. So I would be out in the backyard, and they would be up on the back porch, so we could kind of like see each other, but keep enough distance where they weren't at risk for getting it. But yeah, thankfully nobody got it.
How about within your family? Did anybody else get it for you all, Lynn?
My husband tested positive, yes. Several days later, he didn't have very severe symptoms. Other than having a dry cough and a little bit of fatigue, he got over it pretty quickly.
I think we saw him walking behind you just a moment ago.
Yes,
Is that him?
yes,
Yeah.
you did.
Yeah.
Yes, yes.
That's good.
And I think those. Oh, go ahead.
That anybody could ask for.
Yeah.
I think those are good examples. We've seen in these published reports that 50% of households in contacts have been affected, and within that household, the contact secondary infection rate is again 15 to 20%. We addressed that yesterday, so that would be consistent with what we see, in the published reports as well, even in these small numbers that we're talking about.
Sean has a couple of questions about cytokine storms. The first question is that what Lynn went through? Would that be considered a cytokine storm? And a second part is, if you are asymptomatic, are you at risk of a cytokine storm?
Those are both great questions, Hawk. And sometimes it's hard to know, without knowing all of Lynn's story, if it was really cytokine storm. It's a little suspicious. What do you think?
Yeah, again, we still don't fully know the dynamics of the cytokine storm, the immune dysregulation. We know that after immune system, the adaptive immune system has really taken down the active viral replication, which occurs probably about 7 or 8 days after infection, when your immune system is really starting to build up. And then it's that lag period, but then for some reason there is that dysregulation when those chemicals in your body used to fight off infection kind of have gone haywire. We don't, again, know the full dynamics of cytokine storm. There was a research letter in JAMA that showed that there were maybe less amounts of cytokines in your body than to say if you had another type of infection or respiratory failure type of thing. But it is still, in general, what we are talking about. It certainly could have been that. The other issue is just the other cellular components of your immune system. And then, of course, in your lungs, you have cellular debris, you have old viral debris, you have cellular free fluid, and all of that is working to fill up those air sacs in your lung to help cause that respiratory distress, and certainly you would understand that more. But that is probably what we are seeing. And again, that typically happens in that maybe 7, 10, 12, 14-day mark after the initial infection.
And I think cytokine storm is not just one thing, it's a spectrum of things. And so I think people will have varying degrees of it, and it's hard a little bit to it's hard to explain that other than to say it does occur to varying levels, and it can look a little different in one person to another, and someday we'll understand it even better than we do. But it's probably a mismatch of many different things, actually.
Yeah, absolutely.
And then the follow-up to that question, what was the second part of that question, Jill?
If asymptomatic people
are more at risk. Yeah, I don't think that's a thing. Do you?
I don't think we've seen that. I think one of the problems with the asymptomatic people, and again, we have to make sure we define asymptomatic people, which means no symptoms. There are other people who have mild disease, which they may not even recognize that as a symptom. But in general, those people that are asymptomatic or mild symptoms tend to have maybe less of an immune response. We've seen that in when they looked at antibody titers compared to people who have severe illness and in the hospital. The people with the mild symptoms seem to have lower antibody titers and have less durable antibody titers, meaning they're not lasting as long. Again, we don't know the full dynamics of that either. Those are some of the questions that are being answered. But I think your risk is going to be much lower in that mildly symptomatic to asymptomatic group.
Okay.
Joanne wants to know, why can't you just take medicine to help with the headaches and the muscle aches? Is it effective?
Well, I think you're going to tell us about that, Mara. I bet it did help.
It didn't work. I tried Excedrin for the migraines, ibuprofen. I took Sudafed for the sinus congestion, and nothing over the counter I had. I was kind of testing things different days to see if I could get any relief, and nothing helped.
Lynn, did you try any of those things? You got sick pretty fast, though. It probably didn't work as well.
No, I really didn't. Took a little bit of Tylenol early on. It was maybe mildly effective, but not much.
Okay. There you go. Yeah, so those meds, this coronavirus is just different. If you think about it, even when you have a common cold, you don't really feel normal once you take that stuff. Despite the commercials on TV, which make you think, I'm normal once I take my medicine, I feel great. Well, no, not really, you don't. When you have a cold, you feel bad. When you have COVID-19, you feel really bad, and so stuff isn't just going to work as well.
Linda wants to know, why is it that some people are asymptomatic and then the person sitting right next to that person ends up in the hospital?
Yeah.
If neither person has any health problems, does it have to do with individual immune systems? Do we know why?
That's a great question, isn't it? We don't really know why, to be honest with you. We can make up and we can speculate a bunch of stuff.
Yeah.
I do think people that go into this healthier tend to do better than those who aren't. We know that, and so that's part of it. If you already have some underlying health conditions, you're going to tend to have more of a struggle. And we've talked about that before, whether it's high blood pressure or being overweight or diabetes or underlying heart disease or kidney disease or lung disease. All those things, cancer, all those things really influence how you respond to COVID-19. But if you can take two very normal and healthy people and one person can become deathly ill and one person not, and part of that can be whether or not you get COVID storm, and what exactly triggers that we're not even completely sure about. For a while we thought maybe there was a difference in blood type. I think that hasn't panned out. I think there was a difference in other things that but at the end of the day, we don't really know. We know that men tend to do a little worse than women once they're infected, but even that, I mean, the differences are relatively small compared to the grand scheme of things. So I don't know. Have you heard anything different than that?
No, I would agree. I believe there probably are genetic components, but they aren't simple genetic components. There is so much complexity within the immune system with gene regulation. It's not just one thing, it's a combination of things. That's what the human body is. It's such a complex organism. The immune system is so complex. It's not one gene, just as you said, it's not one blood type. It's not one thing. There are complexities within that. We don't know the full spectrum of that, but that would be a good explanation. Again, we are still looking at that. There have been some reports about the interferon and lack of interferon, the ability to transcribe some of those genes, and interferon is one of the main antiviral chemicals that your body produces. So there are probably genetic components, but they are very complex and they are interactive with each other. It's not just one simple thing.
Okay, Claudia hasn't seen her family in Indianapolis for 8 months. And she wants to go there in a couple of weeks for an early Thanksgiving. She can only drive 6 hours, so she can't make it all the way there. And she wants to know, how does she stay safe in a hotel room? And what are your thoughts about staying in a hotel room?
Yeah, I think you can do that real safely. I think that, the more we've learned about COVID, or SARS-CoV-2, the more we realize that whereas services are important, it's nowhere near as important as what's our breath cloud and what we breathe out. So I think if you wear a mask and you socially distance, you can go safely stay in a hotel room. I've traveled a couple of times back and forth to Colorado, Missouri, stayed in a number of hotels along the way. And, the first thing I do is I don't go into a restaurant to eat. I usually order the food, or I just bring the food with me and eat it right there in the room. Don't spend a lot of time going to sleep. When I go down the next morning in the lobby, I socially distance. I actually didn't eat the breakfast that were there. I brought my own food. I think you can do things to keep yourself really safe when you're doing that, and I think you can travel very safely. And in that way, I don't know that it's a lot worse than going to the grocery store or something else. I think that's probably your bigger risk factor. You know, you're going to the gas station, you're going to get gas. Okay, that's not a big deal. You go into the gas station, maintain your distance, go in, come back out, and wear a mask. And I think it's all about that mask, washing your hands, keeping your distance. I would not be overly concerned about staying at a hotel as long as you follow those rules of infection control. And remember that the rules are road warriors. Say that fast 3 times. The rules are road warriors. I'm not going to say it fast 3 times. I'm not sure what would come out. But I think that if we do that, those rules will travel with us and help keep you safe.
Yeah, absolutely. Nothing to add. I would agree with you. You can be safe in the hotel. You can be safe with driving. Continue to do those.
And you and I are both examples of where we're still here.
Absolutely.
Yeah. Some people, they say, "Are you really there, Stein? I'm not sure you're all there."
Sometimes.
Tom wants to know if Mara wears her mask now.
I do. I wore my mask always before. I was big on mask wearing. I made my family wear their masks. Masks were mandatory. But it was at somebody's house we were all just hanging out. It didn't even think to wear the mask.
And you know, that's
when it got me.
That's the thing. And you probably would have been safe if everybody had been wearing masks. Right. Gotten safe.
Yeah.
And Lynn, when you think about that, do you make sure people wear masks now?
Yes, absolutely.
And
I think it's extremely important.
Have you been out in public?
No, I have not.
Okay, that's probably smart. You're still recovering. What would you say to all the people out there who still just don't want to wear a mask? And there's a lot.
There is, and I know it's a personal choice, but sometimes you have to get out of your own bubble and think about others around you, because you really don't know their stories or what's going on with them. So, just be safe. It's so easy to do. And yes, I know maybe it infringes on some of your rights, but even for that, those are your rights, and you're endangering other people around you if you don't.
Yeah, it's kind of funny. What end is, we all have freedom with responsibility. And we can say, well, I have all these rights, but you don't have the right to run a stoplight and hit somebody. You don't have the right to run into a crowd of people. You don't have the right to burn down a building. So I think we have to look at it differently. Do you have a freedom? Of course you do. If you're out by yourself, do what you want. But you don't have the right to injure other people. And
that's correct.
That's the difference. Mm-hmm. And people can say what they want, but if you don't think that masks help prevent injury from COVID, you're just wrong, right? Yeah. You're just wrong. And so I think that's the part that is just striking. And it's amazing to me that you can look at hospitals where I admitted a COVID-19 patient last night, went and saw her. Hawkeye sees COVID-19 patients all the time. Our staff are seeing COVID-19 patients. We care for, how many did we have this morning that are acutely ill?
30 active. Yeah.
30 active patients. Staff are taking care of those folks. And we don't see the staff getting COVID-19. Why is that? The rules of infection control. They work. And anybody who tells you they don't work is just wrong.
All right, so Gretchen wants to know, do the doctors have any comments on the Johnson & Johnson vaccine being paused?
Yeah, that's we were ready for that one.
Yeah.
Read about that one this morning, nice and early. I know you were too, Hawk. I think this is the story of drug trials, and it's just really popular right now because it's around COVID, that it's not uncommon for clinical trials to be paused when they're ongoing because there's something that happens and people have got to take a closer look and determine whether or not that was really related to the study and the seriousness of the nature of the complication. I didn't say the nature of that complication, how serious it was. Because I think that's really what the study board, this independent group, it's not part of the company that's making the drug, it's not any of the researchers, it's the Data Safety Monitoring Board. Those folks are fully independent. They're not on the payroll of the company. This is an independent group that looks at these events and determines whether or not they think it's a risk to continue the trial.
Yeah, and I think this speaks to the people doing the trial, just like you said. It's the investigators, it's the Safety Monitoring Board. This was an internal thing, not a FDA-issued halt. This was a pause done internally. Again, we've had many vaccines that have come out. I'm sure there have been pauses in those. Nobody has cared about pauses for the shingles vaccine or for the pneumonia vaccine. These happen all the time, but what should that tell the American public? That the process of monitoring safety as well as efficacy is going on. There is not external pressure, but they are going to be doing things, by the book to look at safety, to make sure that if and when a vaccine is brought to the masses, it will be safe and efficacious.
Yeah, I think that's right, and that's true of not only a vaccine, it's true of any drug. Are you bothered at all that the drug is an adenovirus vector-based drug, just like the AstraZeneca trial?
Yeah, I had some concerns for sure, but we know that with any vaccine, whether it's the adenovirus or again any other vaccine that we've seen, things can happen, and so that is why the investigations take place. Was this a random chance, or was this due to the vaccine itself or a component or something of that? And so that's what this investigation will look for.
Right, and they were trying to get 60,000 people enrolled into the trial, which was the largest of the clinical trials for a vaccine, by the way. I think there's an addition by 20,000 or so.
And we know that the adenovirus is not a new technology. This is technology.
I was just going to say it's the basis of the Ebola vaccine and other vaccines, so it should be relatively safe in that regard. And anytime you have a population of 60,000 people undergoing a study, they're going to have normal life events.
Yeah.
The question is, did those normal life events, which may be serious, may not be, were they due to the vaccine, or they were just part of life because that's something that was going to happen to someone when you have 60,000 people in a trial? And that's what they have to go figure out. And that's why you have a data safety monitoring board.
I think we don't even know if this was a vaccine or a placebo.
We don't know, but I'm going to bet it was a,
That's just one thing to throw out there as well.
Yeah.
Loretta has two really good questions. Her first question, and they're totally different questions. Her first question is, someone has died, close family member. The funeral's in Iowa. She has to drive 5 hours, so it involves public restrooms and eating and sleeping one night there. Should she go or should she stay home?
I think, again, those are one of those highly personal questions. It's hard for us to answer. Anytime you decide to do something like that, you will take on risk. I would say to you that, as we answer the question for the earlier caller, I don't think the risk is the travel. I think you can make that risk pretty darn safe by washing your hands, wearing your mask, keep a distance, whether you're going to go to a public rest stop, you're going to go to a gas station, or you're going to stay in the hotel. The risk is the funeral. Because I'm going to assume if you're going, there's going to be people there. And if there are people there, it's going to be harder to distance. And is everybody going to wear a mask? I don't think Iowa has a masking update. Mandate. So some will have to check on that. But I think that's really the risk. It's not the travel. It's probably the funeral itself.
Yeah, absolutely. And that's the gathering. And we've seen countless contact investigations from gatherings like those, weddings, funerals, other parties. So I think if you can somehow understand where that funeral will be held, will a lot of it be outdoors? Obviously, it's getting colder now. Will it be indoors? Can you maintain 6, 8, 10 feet of distance if you are inside around people? You may want to consider eye protection, eye goggles as well while you're in those settings.
Yeah, and you think Stites and Hawk are crazy about those eye goggles. I think we're dead on right, Hawk.
Absolutely.
So, Mara, how many people were at that party, that Chiefs party?
There's about 20 of us.
Okay, so you think about that, and 20 people, of course, you're over the gathering limit. We're not going to say about that. But if you think about it as a funeral, let's say there's 20 people. You're inside and outside of a house. People may or may not be wearing a mask. That could be a recipe, right? That's where you can get COVID. You're proof.
Yeah.
It's probably family members you haven't talked to in a while. It's people you haven't seen in a while. You want to be social like you normally would, but try to maintain that distance and, please get everybody in that situation to be wearing masks. I think you can certainly cut down on spread if everybody in that situation is wearing masks.
Mara, what do you say to your friends now and say, hey, let's get together?
Oh, we don't. No. Well, if we're getting together, we're wearing masks or...
Yeah. So, do people treat you differently because you've had COVID-19?
I haven't had any experiences with that yet. The people that know that I've had it, if anything, they just ask her are you good to walk, or are you good? I'm like, I'm fine.
Well, we're sitting in the room with you and again, we have special ventilation here, and we're more than 6 feet apart. But still, you've had COVID-19, but we're still sitting with you.
Yeah.
Yeah. All right. Lynn, how about you? Are people treating you differently?
No, I wouldn't say they're treating me differently. I haven't had a lot of experience since I haven't been out anywhere. We've made some restrictions in our household here that we have asked everybody to respect our privacy and let me heal here, and everybody's been wonderful about that. So, if anything, I think people just want to know how they can help. and that's been a great blessing. So, yes, I'm treated differently in that way, but not anybody scared to be around me or anything like that, I don't believe.
I think that's good. I think, there shouldn't be a stigma with somebody who has it.
Mm-hmm.
You should, if you understand you have it, do the responsible thing, isolate yourself, don't go back out into society until it's that 10 days after, when you can be back in society. Do that responsible thing. There shouldn't be a stigma about just having the disease. But when you do have it, understand that there is a further responsibility that you have to take to remain in your isolation for that 10-day period.
And Hawk, do you think in people with chronic underlying disease, say chronic lymphocytic leukemia or something like that, do you think they could shed the virus longer than somebody that's healthier or has a better immune system?
Yeah, that's a very good question. We do understand there is a case report about a liver transplant patient, and they actually showed that they were shedding replication competent or live virus till about 21 days. I don't know the concentration. Again, it was from the upper respiratory tract, but they can probably shed a little bit longer if you are on immunosuppressive drugs. And certainly the key to that is what is your level of immunosuppression as well.
And I think that's something we learned in transplant and other populations with other viruses. It's not unique to that's true for influenza as well. So, Jill, time for one more.
All right, so we're going to take a question from Channel 41. Charlie, who's a reporter there, wants to know, what is the warning that Mara and Lynn would give the public about taking COVID seriously?
Wear your mask.
Wear your mask, wear your mask.
It's a lot easier to get than you think. I mean, taking all the precautions that I have over the last 6-7 months, and then it's the one time that I kind of let my guard down a little, and I get it. So definitely don't. I know it's been a long time and we're all kind of over it, but I would definitely say that it's still just as bad as it was months ago. It needs to be treated as such.
What do you think, Lynn? What would be that thing you would tell?
I agree with Maura. It's as long as we've been dealing with this, it's easy to play it off as out of sight, out of mind kind of a deal. And I know everybody feels like, well, that's something that's happened to somebody I know, or I see it on the news, and it's probably not going to happen to me. But let me tell you, it could happen to you. And once again, like I said earlier, you have to be vigilant to keep the ones around you safe also. So I know it's a personal choice, but think about those around you, because no one wants to see their loved ones in the situation that I was in. So if anything else, think about and be respectful of everyone that's around you. Wear those masks, wash those hands, and be vigilant in it.
Yeah, those are great words, Hawk. I don't know if we can do much better than that.
No, I think said it all. And even you, Mara, being young, you still felt horrible for those 3, 4, 5 days as well, like you said. So,
and we see young people hospitalized, so we're glad you're here. We're glad you're both here.
Yes.
And thank you guys for both being with us on this program today. It means everything that you came to tell your story, and we wish you the best of luck in your recovery and in your ongoing education and in your life. And 2 folks, I bet, are great nurses, so that's awesome. Hey, remember to send us your mask pictures. We really do look forward to seeing how you use your mask for Halloween, and if you're going to trick or treat, what you look like. So we'll be looking forward to those. Tomorrow, Dr. Heather Harris, who's the medical director of our HaysMed campus, joins to talk about the virus spread there and what the community can do to blunt that curve there. Listen, please remember to hear and hear the stories from Mara and from Lynn, and remember Anil, because he did a great job talking about his comments around mask wearing and playing it cautious. We're going to hear about that in a minute. I just wanted to remind everybody that, a few weeks ago, maybe a little while ago, we talked about 50 ways to love your mask. We haven't forgotten that you sent us stuff. That's still coming to you. So that'll be played back to you in the not-so-distant future, and look forward to sharing that with you guys, because there were some great ways about loving your mask. Those things are going to come back. We won't say haunt you just because it's getting so close to Halloween. Do want to say to you a special shout out to all of you out there who've been trying to carry the banner of wearing a mask. I know sometimes it's hard, you don't want to do it, it's hot, it's sticky, it gets wet, it's uncomfortable, you just wish you could take a deep breath without it. But there will be time for that soon enough, and in the meantime we're going to keep each other safe. And remember, there's still no place like home. Remember, let's hear what Anil said last week, I believe, a COVID-19 survivor who says that being cautious doesn't mean that you're living in fear.
If I could go back in history and go back to April and figure out where I got it, I would definitely do things different. I would not live in fear, but I would definitely, be safe from going forward. I object to that interpretation that being cautious is being fearful. It's a lot more frightening to stare down your own mortality in minutes and hours than it is to try and avoid becoming a vector or having contact with one.
SARS-CoV-2 is indiscriminate in who it attacks. And if you set yourself up to be vulnerable, it will come to you.